Can you talk us through your journey?
During my medical education, my sister fell sick and we don't have the consultants that are available and she developed paralysis. During that time, we decided that I need to create all the healthcare nearer to the public.
You were one of the pioneers of Arogya. Can you explain how that idea came to you, sir?
Create a scheme in such a way that patients can only pay the cost to cost.
Why maternal mortality ratio in Kerala was equal to almost that of Sweden, but some states are still behind.
Because they have been habituated in the government health, unhygienic ways.
You did a project in Afghanistan. Can you just take us through how you reached Afghanistan?
A gesture of helping them.
Do you think is it money, is it motivation, or is it skill?
It is only one purpose: is you need to improve your quality of life.
In terms of healthcare, where does India stand?
It is much better than United States of America.
Say 15 years ago and today, healthcare education is on a better footing.
The education itself is not a correct way it is going on.
Welcome to Conversations on Hybis TV. My name is Suresh Kochatal. Healthcare professionals, they say, are like God. And more importantly, they're God-like. And today I have with me a gentleman who has traversed all this and more. B. Bhaskar Rao, the Managing Director, and you can say even the founder of KIMS, across states like Andhra Pradesh and Telangana today, and even growing beyond the borders of India. Today, we will speak about his life, his times, and the road ahead. Welcome, sir. Namaskaram.
Namaste.
So, sir, I will start with your basic journey. You are born in a small village in Nellore. That's what I was reading up. Can you talk us through your journey, your 5 siblings, including you, your parents, your education and all that?
So, I was born in Nellore. My parents are Bollineni Ramanaya and Venkamma. As you pointed out, we are 5, 3 brothers and 2 sisters. And we have very low and middle class family at that time. We are having only 1 acre of land. With that, my mother has come from a little bit educated side, and she was always keep saying this 1 acre may not be enough for all the 5 children to survive. So education is the most important thing. That's why she forced all of us to go for education, and we went and studied my grandmother's house, staying there and going for the school. And at that time, the girls going for a school is not a very routine thing. That's why she didn't send to my 2 sisters. So all of them got educated there, and then my elder brother is an engineer and my second brother is a agriculture BSc, and both of them started as soon as their education is over, entrepreneurial journey at Rhodes. Then I was the youngest of the 3, and then I have passion to study medicine, and I got attracted in my village, one RMP doctor who used to see morning and evening lot of patients. He used to get a lot of respect among the public. Then that got attracted. Then when I was studying my intermediate, there also 2 hospitals were there. They are also very rush. Most of the patients used to go and happily home. So then I thought I will be able to do medicine. That's why I joined in medical college. After doing that medical college, seeing that medical college, medical education, the poor status of the hospitals in this country, when I have been toured to outside the country, the gap between what we have and what is there in outside. During my education, medical education, my sister fell sick. We don't have the money to go and show it to in a right time, and we don't have the good consultants that are available nearby. That's why it got delayed and she developed a paralysis. During that time, we decided that it is a heart ailment. We need to be in a heart surgery to help the poor people. And we need to be able to create all the healthcare nearer to the public. That's why I started my first hospital in Nellore. To get into entrepreneurial journey, as I saw that the gap is vast, not only in India. At that time, there was very few places only you have all primary, secondary, tertiary care available. Most of the metros like Chennai, Bangalore, Bombay, Calcutta, Delhi and all those places. Districts doesn't have any sort of healthcare, proper healthcare. So that's why I want to build a good nearer to my own town. So to do that, as I mentioned that we are not that rich and to go into an entrepreneurial journey. So I studied my MBBS. The desire is to continue an entrepreneurial journey. Then I did my MS from Madras Medical College. Then I did my cardiac surgery in CMC Vellore and Apollo Hospital, Chennai. From there, the training was not perfect to become a consultant. My boss, Dr. Girinath, sent me to Australia. I spent about 3 years there. In these 3 years, I got well trained. Not only well trained, it's an eye opener for the healthcare how it should be. So that my desire has been even strengthened by seeing there of becoming an entrepreneurial journey. From there, I came back and again keep thinking, again finance is the most important thing, which is not there. So then I started as a consultant in Hyderabad, Medwin Hospitals. From there, I used to go to my hometown, Nellore, to provide quality care to my people. I see every month OP, bring all the heart patients to Hyderabad, treat them, take them back, and again follow up there only. That makes a little bit of satisfaction I can able to provide for my own people. Then after that, I realized to make an entrepreneurial journey, what are the important things? 3 important things is, 1, you need to have a good accessibility, affordability, good consultants, and good finance. So to acquiring this finance is not available, then we started my short entrepreneurial journey in Mahavir Hospital, where with a 50 beds Mahavir Cardio Vascular Centre, where we invested there. With that showed a good confidence on me. I can able to manage, do surgeries, and provide quality healthcare. Whatever is the savings that I made during that time, I started my first hospital in Nellore, where I want to show to my people where I was born. So that took off very well. That encouraged me to start entrepreneurial journey. I can able to do it. Then my second hospital, I did it in Rajahmundry. Third, I did it in KIMS, where when we want to do KIMS, we need a lot more money. Both the places, Rajahmundry and Nellore, are done by on my own. When it comes to more money, then I thought how to generate. Then I take doctors as the partners, and my family has supported. So all these people, we could able to establish a good hospital, and we got the good consultants, luckily, and all these people made this venture a fruitful journey. That has given a lot more confidence of doing more hospitals. From there, the history shows wherever there is a hospital that is available, I could able to acquire that and turn around when the hospital was not doing well. And that's how we could able to build this entrepreneurial journey. When we want to expand more and more, the amount that has been raised by the doctors was not enough. Then I took some private equity money where to build a Secunderabad 1,000-bedded hospital. That took off well, and then these private equity people keep changing every 4 years. Then I thought we lost. In 2018, we decided to go for an IPO so that I need not able to replace private equity people every 4-5 years. So that journey, that has given a lot more confidence on us. More and more investors has come. More of a understanding of the healthcare, much better, governance and everything. And visibility of the entire nation of healthcare is much, much superior. So with that, again, it encouraged us to go to the more and more outside states. Till the time I was only in Andhra and Telangana. I purposefully stayed because of the political situations, the doctor availability, accessibility, affordability is my core thinking. So after doing an IPO, and we have been established by the time 3,000 beds in Andhra and Telangana, then when we have visibility, then there was a lot more opportunities that are coming in Maharashtra, Karnataka and Kerala. And we started doing hospitals. Now today, in the next 2 to 3 years, we are going to do another 3,000 beds. Total will be around, in a couple of years, it will be 6,000 to 7,000 beds.
Now, when you talk of your journey, so you went to Australia to learn from there, as you said, Dr. Girnath sent you there. But also the fact that the healthcare within India over the last, say, 20, 25 years evolved in terms of more of private participation. The primary health centers are still there, but as you said rightly, in a place like Nellore or Rajahmundry or other places, these things are still evolving. Today, it's of course big time. Where do you think the healthcare situation, because in our country, the GDP spending by the government itself on healthcare is very, very low. What do you think we need to do to improve patient care in rural areas?
See, basically, whether healthcare is concerned, whether it's a rural area or an urban area, is entirely different. Everywhere, the primary, secondary, tertiary, and quaternary care is required. The only problem that is there now, there are a number of patients that are available everywhere. But only thing is the viability of an entrepreneur person is most important. As you rightly pointed out, when we want to do everything by government, they would have been done everywhere, every district, a good hospital. But because of the cost constraint and the GDP is very low in the healthcare budget, and in the beginning itself, it was the healthcare was partly by government, partly by few of the charitable organizations, where like Christian missionaries or Hindu people, like that the charitable organizations were there and the government institutions. Later on, when the doctors getting trained well, now the doctors has been taken upper hand and starting their own small nursing homes, from nursing homes to corporate hospitals. Thanks to Dr. P.C. Reddy, who has shown the vision for a corporate hospitals are required in this country to provide a good quality health care. That's why many entrepreneurs has come forward. With that, the investors has come forward and they are doing it. Now to provide, now it is become very expensive because of the infrastructure cost has increased, the technology cost has increased, and the human resources cost has increased. Everything, it is become a challenge for the middle and lower middle class people to have affordability in the healthcare is concerned. To overcome that, government is trying their level best to provide a universal health scheme. State governments are putting a subsidized health schemes and all. Beyond that, what we need to do is we need to be able to encourage the more and more patients should go for an individual insurance. The day when the people will get an aware of insurance, and then that is the way we can able to create a good quality health care in every small towns also, so that each and every individual of the Indian population do get a very good health care treatment.
So,
That is missing now. Many people think that one false or myth in insurance is that we do insurance for everything. When you travel, you do. When you buy a scooter, you buy an insurance. When you buy a car, you do the insurance. When you travel, you do an insurance. When you buy a house, you will do insurance. As far as health is concerned, we don't do that. We will totally neglect. Health is wealth. So even though you have everything, there is no health, you can't do anything. So the other important thing is, many times we think that we may not get sick. We never know when we are going to get sick. So it is always better to safeguard ourselves and put some premium and do health insurance, so that it will be very accessible to every hospital in the country. Even though the government gives, it may be certain areas they can able to provide. But unless you also do have some insurance, apart from using the government insurance and as well as your private insurance, you can able to access to the high-end corporate hospitals without any cost.
so when you talking of insurance, also you were one of the pioneers of Arogyasri. You came up with that concept and later on convinced the then Andhra Pradesh government, I think especially Y.S. Rajshekar Reddy Garu, to kind of implement the scheme. Today, that scheme has become very popular. Today, you see every state government kind of duplicating the same scheme. Can you explain how that idea came to you, sir?
See, basically what happened when a good friend of mine is Dr. Rajshekar Reddy, the Honorable Chief Minister at that time. One day he was asking Bhaskar that there are so many patients are coming in the morning that they want help. financially help so that they can able to keep up their family members without succumbing into the diseases, and finally they may land up problems and they don't have the money how to do it. Then I said, what is the population that do we require, we need to support? It is hardly 20% of the population are below poverty line. I need to able to help them. Rest of the people can able to support themselves. Then I told them that 20% is very easy to support, because any hospital you take, there will be 20% of the beds will be vacant. You create a scheme in such a way that this 20% of the patients can only pay the cost to cost. Hospitals need not make any profit, because anyhow without them there will be vacant beds. So that's why this scheme has come, and we have been created on a cost to cost basis and created a packages that took off very well. Later on, when it took off very well, now during that time, he only asked about 4 specialties. One is the cancer, the second one is the brain surgeries, third one is the kidney surgeries and the heart surgeries. These 4. Once it took off very well, then many people have approached and created, you extend more and more diseases. Then you keep on extending, thinking that. Then later on, this 20% population have become 90% population are below poverty line. So when it becomes that, then it is becoming unviable for the hospitals. And that's why the corporate hospitals may not be able to challenge. Even we suggested some co-payment will be able to help to cut down these people entering into the corporate hospitals. That also they didn't follow it. So now today, Arogyasri, with that, now Ayushman Bharat by the central government has been created. Even today, if you want to improve, there should be some co-payment, so that the patient, whoever is coming, they will think twice whether, and they also check whether I need to be able to do, so that the misuse by the hospitals will not occur. So co-payment, one, or the government can able to do up to a certain level. Beyond that, if they want to go for a higher end corporates, they should be able to have a self-insurance. That means you will have a dual insurance, one provided by the government, another one individual can able to do whatever is the sum that they require, so that both combinations will be able to help the present scenario of healthcare problems in this country.
So one of the things that you did also, that you not just created a health infrastructure within the country by setting up KIMS and other hospitals. You also went abroad. You did a project in Afghanistan. Can you just take us through how you reached Afghanistan?
So in Afghanistan at that time, my brothers, as I mentioned before, that they were the contractors. They bid for some roads in the Afghanistan, which is an American company has called for that bidding. When they went there, they saw that there are not many diagnostics, and their healthcare was very, very bad in that country at that time. Then for every CT scan or MRI, they used to come to Delhi and get it done and go. So one of the doctor has approached our people, you have also a hospital in Hyderabad, why don't you set up something here? Initially we thought of setting up only diagnostic center and test what exactly is there. In that we also took one doctor also as a partner in that. So we set up there a diagnostic center, so that most of the CT scans, MRIs, ultrasounds, they need not come to outside Afghanistan. They used to get it done. And because getting a human resource is also a tough job, then we used to do a teleradiology from here, because most of the things are radiology, blood investigations. Then when we started that, many people have seen that this is a good idea, and they themselves have been established. And with that, they also started few hospitals on their own. Then we gave that diagnostic center the local doctor who were partner with us, and we came. That's how they improved that. It's only a gesture of helping them, because we have done works and they made some money. We want to create something to the society for that Afghanistan public, not to travel.
So when you look back at your long career with 30,000 surgeries that you have done in your record, I think it's more now. When a sense of self-satisfaction comes saying, I have given so much to the society, I've done so much, do you think the next generation of entrepreneurs, you rightly spoke about doctors now setting up small clinics and then graduating to things, do you think the benchmark to do that, is it money, is it motivation, or is it skill, or is it a combination of all three?
See, basically, it is always a combination of all those three things. Basically, all of us should be able to understand we are all educate ourselves, either medical, engineer, or anything. It is only one purpose is you need to improve your quality of life. To improve your quality of life, we need money. Money is definitely is a one important thing. Then you also need to have a passion to do any of the profession you want. If you don't have a passion, you only look for money, then you will not able to a successful personality in both in profession as well as in the finance. So passion is a must. During that passion, you can acquire all the skills what you require. When you have a passion, you go and grab all the skills everywhere. You go for conferences, you go for observerships, and then get everything, and then the skills will come. From there, the passion will be there. Then you will have a confidence. Yes, many people are trusting me, the patients. Then I want to do more and more. With that, then the entrepreneur journey will come. So all these three combinations make a doctor will be more happy, and he will feel that I have done justice for my profession. That is the theme.
As we move towards the end of this conversation, I come from a state like Kerala, where healthcare parameters were very good even in the 18th century also. Ayurveda was a big thing then. Why maternal mortality ratio in Kerala was equal to almost that of Sweden, say almost about 15 years ago. But some states are still behind, lagging. Is it the lack of education or lack of primary health care that is forcing many states to still struggle to control their maternal mortality ratio and infant mortality ratio, which are, as you know, are the two benchmarks to guide a state? And when you look at countries like US and UK, where UK has NHS, US has a combination of Medicare, Medicaid, and private. Do you think, where are we in terms of all this, in terms of healthcare? Where does India stand, sir?
See, basically, when I went recently about 6 months back to Kerala market, I am also surprised to see that a state like a very small state, the maternal mortality, as you pointed out, is much better than United States of America. And we worked out they are very, very consciousness about their health. But the other important thing is they also spend money, and they also understand the healthcare is expensive. That's why they don't hesitate to go there, because they are all educated. The literacy is very high, and they also think that when the literacy increases, automatically everybody is educated. What will happen? They will be able to understand the significance of what doctor says, how we need to follow, and what all the things that we need to do. That's how this maternal mortality is very, very low, because of their education, because whatever the doctor says that they will follow. The rest of the states, what they do is they still get it done at home, deliveries and all those things, unhygienic ways. Even in the during the birth also they don't money. The Kerala is entirely different. They are conscious about their health. They know that we need to pay to get a good health, and they are all literacy. And apart from that, they always look that healthcare will not come for a cost. They don't mind spending that. Whereas in other places, because they have been habituated in the government health, the nursing home type and all, they totally neglect. That's why they will take it very easy. Even the hygienic things or communicable diseases, whatever is the things that we are saying, they don't follow properly. That is the reason the infant mortality or even the healthcare is not that great. Even today, I must say that in more than metros and other things, Kerala state itself has a very good healthcare things.
So when you look back at your journey as we end this conversation, coming from a small village in a low district, then you were studying degree, I think, when you got the admission in the medical field. You went and did that in Kakinada, if I'm not wrong. Correct. Then you went on to, CMC Vellore, you did Apollo, DNB and all that. And then, of course, you also went abroad. Do you think every child today who wants to be a doctor, of course, the number of seats have substantially gone up, both in the basic medicine and also in the postgraduate level. Do you think, say, 15 years ago and today, healthcare education is on a better footing than before, sir? So a person like you, because you've gone through it all, you can talk about it.
So basically, healthcare is definitely better when compared to when I was studying medicine, at that time CT scan was not there, MRI was not there, cath lab was not there, only hardly X-ray in few of the hospitals, mostly on clinical dependence, all those things. But as such, the education itself is not a correct way this is going on. We are not able to rectify that. What we are doing, the one reason why I say to confirm my statement, today the people who are doing degrees and the people who are doing the job is entirely different. So that gap has to be filled. If you don't fill that gap, the education has no meaning. I'll tell you an example where in healthcare, if you practice the same thing. Because we selected a medicine or engineering or IT beforehand, and then you continued your journey like that. There are so many courses that they are doing without knowing what's going to happen. So what I suggest, in intermediate itself, it should be skill-based courses. Even though we have so many courses like that, universities, skill universities and all, but today if you talk about healthcare is concerned, apart from medicine, nursing, paramedics, there is no other courses in other like. So we have so much of insurance, we have patient care executives, we have management of courses, we have a class 4 employees, security, everything, food and beverage, every aspect. There is no proper degree which is studied in healthcare itself. They study some degree which is unrelated to healthcare and come and trying to learn like billing and all those things. Suppose if you are able to create courses which are required for healthcare, so that they will, without wasting those 3 years of degree, they can gain some knowledge, they can gain some skills, and they can do much better in the healthcare, so that the patient quality care will improve.
Wonderful, sir, because that's exactly the point, because training is very important. And as you rightly said, skilled manpower, maybe at the top level, is still available at doctor level. But if you look at the support departments, there is a huge lack of kind of manpower there. Thank you very much for speaking to us, Mr. Bollineni Bhaskar Rao. And I'm sure those who watched this interview will realize the journey that you've been through and how you've reached where you are today. Thank you very much, sir.
Thank you.
Ladies and gentlemen, that was Sri Bollineni Bhaskar Rao, Managing Director of KIMS Hospitals. A gentleman who came up the small way from a small village in Nellore district of Andhra Pradesh to where he is today. And sure enough, he set up benchmarks for the rest of the industry to follow. Thank you for watching. Jai Hind.